primarily the drivers for all specialties are to be able to reach out and provide your services effectively, efficiently, compliantly across as broad a reach as you can. I have associates that I've worked with a number of years, cardiothoracic surgeons, neurosurgeons, people that typically would act in a way in the hospital to maintain control of that patient because of the probability of a change. They are very slow to let people leave the ICU or leave the hospital because it's outside of their area of control. With the Hippo technologies, I've been able to work with these folks on an individualized basis, people I know that I've expressed to them we have this technology and capability. And I had a cardiothoracic surgeon tell me just recently, that's ideal. He is preferentially sending people our direction because he has the ability to monitor his patients that he would be concerned about remotely without the need for them to bring him into his office, or without a concern that there'll be a change that he can't affect an acute adjustment to their plan of care. So they get better care, they get more consistent oversight of the people that are important to have in their circle of providers. It's hard to get a cardiothoracic surgeon to go to a skilled nursing facility. But with Hippo, they can reach out and be there and make decisions that are going to affect the outcome. It's been a real game changer for us and for them. What it's done is it's provided that level of support for them that they haven't had in the past, where they had to act and think maybe with less information than they would like. The confidence levels tended to grow, their satisfaction in their jobs has improved. From the beginning, the training element of it, we have different people. So our group of extenders, nurse practitioners, those sorts of folks, first time you put on the headset, they're trying to figure out, okay, how does this impact me? How can I use this to help make my job easier? How can we take better care of patients? They rapidly progressed in their ability to utilize it. This is a voice activated and controlled device. It's as if I were there at the bedside with them. They can hear me. We discuss patients while we're looking at them, where I'll direct them in their assessments or in their physical exams, and then we come up with a plan of care and implement that as they are at bedside. Going on to a different group of folks that wouldn't normally have been engaged in this, we utilize the tool as a way to assess acute situations at 3 o'clock in the morning. If somebody is decompensating, the prior answer was, well, let's call 911 or get it, send them out to an emergency room. Whereas now we can go to bedside. The nurse literally goes to bedside, turns the unit on without any training. We have instructions for them to be able to do that. And so if an agency nurse is there, they're able to do it, even though they have no training in how to use the device. We've set it up so that it is a level of use that allows us to assess remotely what we want the plan of action to be. So difficulty, short of breath, let's get them breathing treatment, put them on some oxygen, come up with our plan, and try to avoid the disruption in their lives and their care. If you're a nursing home resident, you don't want to be tossed around and thrown in an ambulance, taken to an emergency room. And I mean, it's very disruptive for patients, families, the staff. This has allowed us the ability to address those things that we can address on site, If we need to make an assessment that's done in an emergency room, well, then we'll do that. But it's an informed decision that we're making. We've seen a reduction in our acute send-outs that's been significant and has made a difference for us as in both patient satisfaction, our teams, and then the performance in the facilities.